Hello, sir. Hello, sir.
Hello?
Can you share your PowerPoint
Oh,
presentation?
yeah, sure. Wait.
Please share, sir.
Is it visible?
Yes, sir. It is perfectly.
Yeah.
Shall we start now, sir?
Okay, 1 minute, please.
Yeah.
Okay, good morning. I'm audible.
Yes, sir. Okay,
Yeah.
sir. I will start first. I will introduce yourself. Then you can start.
Okay, sure.
Hello, everyone present here virtually. I am Nalini here, and I welcome you all for today's session, which is titled as a novel remote healthcare monitoring smart system using Internet of Things. And presenting this session, we have with us our today's expert, Mr. C.M.M. Mansoor. Mr. C.M.M. Mansoor is a senior lecturer in a computer science, Southeastern University of Sri Lanka. His qualification is BSc in a computer science, MSc in a computer science, and MPhil in a computer science. PhD is a research interest in a machine learning and artificial intelligence, data science and analytics, computational medicine, data meaning, programming languages, architecture aspect of embed system and design, application specific instruction set professor. Without wasting much time, I am welcome to Mr. Mansoor. You can start now.
Okay. Thank you very much for brief introduction about me. So, without further delay, I'm going to start this session. Basically, this will be based on some emerging technology with the healthcare sectors. Uh, First of all, I welcome you all, especially all the students and research scholars and maybe the participation from the medical background and all other uh, students. Uh, so I welcome you all for this international webinar on remote healthcare system with the help of Internet of Things. And also, I must thank at this point organizing kind of webinar via digital platform, the research circle, the director, and all other members of this research circle team. So thank you very much giving the opportunity to share some idea with the other part of mm, uh, students and other research scholars. Uh, so now I'm going to deliver my presentation. Today's topic is one of the hot and very interesting and very important topic nowadays, healthcare with help of some emerging technologies, right? So I'm senior lecturer in the computing field. Is part of Sri Lanka. I have experience more than 20 years in that computing field. I've been in many countries and I have published many papers in reputed journal, high index journal, and also now also work in the same field myself and with my colleagues. Okay. So with this small introduction, I'm going to directly enter the presentation. Now we are going to discuss about, as I told you, how medical field transforming the digital format and what technology is used nowadays and what would be the results, what are the challenges, and how information technology or technology incorporate with the medical field. So many things we are going to discuss, and within the time frame, very limited time is I with so that with that end of the session, you can have some question. Okay, this is the content. Maybe I'm going to cover up today's sessions from the digital healthcare to up to challenges in between them. So we will discuss some more important crucial point with regard to this given title. Okay. Now, the digital thing or digitalization or digital transformations is a very common everywhere now. People are talking about that digitalization or people involved with the digitalization. Basically, what is the meaning of digitalization? So, right. So digitalization basically, if you go in deeper, maybe the zeros one. So now what uh, uh, in what form we have in previous manner. So now we are going to change it the way we deal with the field in digitalization. Digitalization. It means that now there are different fields in the world. Maybe you can represent one of the field, but actually, after the revolution of the technology, maybe it involves with all the field, it behind the scene, basically. The healthcare is one of the biggest sectors in the world. So each and every countries nowadays they are focusing to improve their health sectors. Basically, in the developed country, almost they have done a final job with connected with the healthcare sectors. And also developing countries like India, Sri Lanka, Nepal, and other countries, they are more given concern to improve their health sectors inside the countries, because it is a very, very important things, and make sure that each and every citizen in the country have a same privilege or easy to access the healthcare things with the help of in what form, basically. But so that more countries, even the digital India, it was, I know that it was established, I think, 2015. So one of the seven pillars, or I think nine pillars, nine main objective in digital India. One of the objective is they are focusing on the improvement in the digital health sectors, health sectors. So that is also like in Sri Lanka also we have now many ICT professional and other professional, they are working together, and uh, they are now working on the digitalization of digitalization uh, in the health sector, right? So that it is very important, and since we all are from the ICT background, so we must know that how the digitalization or how ICT or technology can contribute to the with the connection of the health sector, and how it contributes to the real world, real society, or the country, or each and every patients in the country. So that is a very important one. So I'm going to have some ideas how the digital revolutions happen so up to today, and what are the technologies have involved with this field, something like that. So that is the idea behind this. So basically, if you go for that, the digitalization concept, transferring health sectors, digitalization. So behind these scenes, there are many uh, tools or concept involved with this modern imaging digitalization of the health sectors. You know that we learn uh, maybe some of concept, Internet of Things, medical of Internet things, and sensors, and maybe the machine learning, deep learning, and cloud computing, edge computing, fog computing, and other softwares, and other hardware devices, Arduino, and other some devices like that. Maybe there's some maybe the network related concept. All these ideas or concept or technology interconnected with the digitalization or modern healthcare sectors, right? So then we will look how this concept incorporate with this digitalization concept a little later. Then Actually, if you look at this digital health success, there are many advantage of the digital health results. So I'm not going to point out one by one. So we can obviously know that how digitalization gives the results to the each and every citizen to the real world, right? So there are so many things like that. So also, if we are going to discuss about some health sectors or remote health sectors or technology aspect health sectors, many elements involved with this health sector, basically not only the patients, so not only the doctors, not only the nurses, not only the government sectors. Oh, many stakeholders involved with improve the health sectors nowadays. So some bodies are directly involved with this scene, or some are indirectly involved with this sector. So without this, their contribution, basically we cannot come up with a very potential or innovative solution. Why? Because medical doctors cannot do whole thing. Maybe the software or ICT professional cannot do without the helping of other parties. So that to make the health sectors in a very imaging or very sensitive one. So each and every one, they should contribute in a different way, so that it happening now. It happening. Most of the biggest companies invested in trillions and US dollars to make some to find some new ideas, new concepts, and they are working hard day and night. I know that, and also most of countries, even the India also, they are working. There are different under the project. So because like India, the very huge crowded countries, very many population. So the country leaders, they should make sure that healthy people of the country, so that it is not easy task anyway. There are different across the world. There are companies, countries, leaders, professional, everyone working behind the digital health sector. So that now, if you go in one or two decades up to now, so you can realize, you can see that some statistical factors. It shows that how the investment has been increasing throughout the years, from the last 10 years, 20 years, how companies and other organization investors, they are investing the money and time and professional working hours. So there are people involved, and they are increasing. It shows the statistically, basically day by day they are improving, increasing the percentage of the work, right? Okay, that so now you can got some idea. Basically, now the all countries and the parties who are connected with this scene, basically they are working very hard to produce something new to the real world. That is the big idea we can get. And maybe if you go the health sectors, there are many things you can. So maybe I think that some of you have a background from the medical fields, and others you don't have. But I'm sure that maybe there are space to accommodate all kind of the activities, most kind of the activities through the digitalization way. In the health sectors, you know that there are plenty of activities, or plenty of field, or plenty of maybe uh, certain kind of uh, program is there. So that how the problem is how these medical sub activity or activities how can interconnect with this digitalization way, how we can bring this each and every activity through the digitalization way. So now almost in the developed countries, if you look at this one, so they are maybe now it's still most of the research is going on and not completed yet. But according to the new statistical says that most of activities in the health sectors they transfer in the digitalization format. They are transferring the digitalization format. Maybe probably in future, we can see that the results of this um, digitalization or results of this work, right? So the technology has a space to accommodate the summary of what is this one. Technology has a space to accommodate to all kind of activities of the medical field, right? And maybe the modern digital sectors, there are kind of uh, division. So kind of activities. Maybe some people say telemedicine. They are using the mobile or different kind of devices, and also they are maybe they are the way of accessing the data through the digital format, or maybe you don't without going to the hospital or without going to the frequent test. So they are when the people at home or in the particular place they are accessing or getting treatment or advice through the different ways. So now the medical has maybe they change the format. So in maybe it is big changes in the medical field. You had some experience now. We all severely um, mm, um, involved with the COVID pandemic situations. 2, 3 years, we severely involved with the pandemic situation. So now you can realize is how I will come little later. How can I can say that how the digital format of or digitalization or digital transformation of health sector can contribute to the people without going to visit the hospitals or medical centers or somewhere else. So how technology help to the patients, help to the people to get the medicine, so get advice, or consultations, or any other type of format of medical things, right? Okay, that this is the short. I'm not going to take much time. This one, maybe it happened last couple of years. Maybe the people now see that people talking about there are some telemedicine, EHR, and other maybe IoT and mobile health and some other testing inbuilt chips on the organs or something like that. So there are many revaluations throughout the years, the medical field. you can see that. So even maybe we all know that what changes happened so far in the medical field and what we are going, where we are going. So something like that. We have to get some idea about this thing. So telemedicine is basically the medicine is okay. What is the routine medicine? So normal medicine. So right now without involvement in any other technological aspect. So we just go to the hospitals or anywhere, maybe take the medicine, get that way, something like that. So telemedicine, so basically, what is a telemedicine? So, maybe technology involved with the medicines, right? So you don't need to go to the maybe sometime if you want to go to visit to the some other countries or for the medicine purpose or maybe medical purpose or some other places or distance be very high. So that now the how throughout the changes. Now you don't need to visit the hospitals or in any way with the help of the technology aspect. Even you can get diagnosis and treatment and get advice or something that so the technology help for technology interconnect with the people and the medical field. So it is a very revolution of the medicine. So now that is the one idea. So probably if you look at this one, the telemedicine, so yeah, now it's possible. Now possible, right? So maybe you don't need to go for the places. You can take even the insulin, glucose level, and oxygen level. So many things without visiting the physical place. Wherever you through the technology you can get you can get the results and you can get the medicine. So you can get the test. So so this is the actually the results of the telemedicine. So technology. So what is this? Basically, if you look at what's the results of this one, probably the very important thing is saving the time and money and maybe there are a lot of advantages behind this one and only to express one by one. So without through or via telemedicine. So maybe very important one. You don't need to go to the frequently the hospitals. So money, energy, and maybe some other psychologically. So you have a relief. So that telemedicine brings a solution to the patients in many ways. Okay, and also during the COVID time, you can realize what happened. So there not possible to go to the places and other things. Maybe visit the hospital. Impossible, right? So in that time, so wherever you were at, and you were able to get some treatment through the technological way. So we realized that right, that is the result of one of the digitalization of healthcare sectors. Another thing is now most of the countries, even the India, now they are focusing to 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 uh, to uh, so make this centralized so in other different type of databases. Each and every citizens of country electronically record the details of everyone's every patient's health information, right? So it is called electronic health record, right? Even there are some um, point to be discussed, maybe the security, privacy, but actually electronically health support is each and every presence in the country or in the city, in the village. That's a very important, and it will be definitely helping to the medical field at the same time patients to to get some medical treatment, right? Without invest maybe they're spending money, time, and other things. So it's a big project. I think in India also they digital health under the program. So they are collecting information even as well as well. And other most of the countries, Europe countries already they develop. So if you just have a ID, so just you don't need to maybe go to the hospitals. Even if you go to the hospital, you don't need to elaborate about your history. Then, if you give you a unique ID, so it uh, uh, they can able to get the whole history about you from the databases, right? It's a huge program. That is a, so medically, many things can include in the database, right? So maybe this will be this one. So maybe it is a database like this one. So it depends on the medical institutions or maybe the professional. They can decide that what type of things they want to store in the databases, right? So you can practice it since you are a researcher, maybe in the field. So you work with the medical team and ICT expert and maybe another some people. You can work together and you can develop a kind of healthcare databases, right? So this is definitely it will be help to both sides, maybe the medical people, professional, and the same time patients, right? That is all. There are some internationally, and there are different type of software available to manage or to handle this type of uh, um, medical health record, right? So you can go through this one, right? And even there are a lot of advantages if you have a history of the patients in a digital format. Basically, it is will be a very good advantage in both parties concerned, and as well. But on the other hand, maybe the security, patients, privacy, data, and some question behind this one. Even though even we had to think about some negative uh, things. The advantage of this uh, keep the electronic format will be higher than the negative thing. And also, what now the in so, robotic, right? It is now in the medical sectors, medical areas. Um, most of theaters and other places, they are inviting the robotics to help the medical professionals, right? So it definitely very sensitive manner. The different type of intelligent robotic work with a medical professional for the different type of task, specific task. So especially surgical time and operational time. So maybe the professional medical professional able to get some sensitive help from the robotics. So nowadays in Europe countries or Western countries, they in the medical side almost they are medical professional work with robotic for their jobs, for their tasks, right? That is something like that. Okay. Maybe, and also nowadays, if you look at this concept, we are medical advancement or medical revolution. So you know that many wearable devices available in the market. What is this says medical devices or medical wearable devices, right? So it is basically the normal routine disease like blood pressure, heart rate, oxygen level, maybe glucose level, and other kind of parameters like so. So normally the elder people who want to go to hospitals to check their medical conditions, and frequently they want to visit, and for the patient who has a high blood pressure and other cardiologist disease like any format. Say the medical people advise them to come to the hospitals to check their some routine medical tests. So I'm just saying the example for that, not only this one. So that after the wearable devices, after coming to the wearable devices, so are the under after advancement of the medical some devices, right? So think about now you can check to yourself without going to the hospitals, without spending the money, time, and psychologically uh, uh, get some disturbance. So that no need to go though. So this is the one of many countries like maybe you know the Apple companies and other companies and other medical, even the Googles and other big companies investment for this kind of work. So that there is a revolution of this one. So remote healthcare monitoring system basically behind this one. So remote healthcare. I'll come little later, but I'm going to share ideas. And it's basically wearable devices, wearable medical devices, or inbuilt with one or two or many sensors, right? So to check kind of parameters, right? That is kind of some you can just wear, or sometime you need to inbuild the organ of the body, right? So I think the to check the glucose level of the human. So there is still going on research to to using the wearable device. Instead of that one, there are inbuilt some um, uh, medical sensors in the organ or body, right? So maybe this one. Right, the same idea. So now the same concept is applicable here as well. So what's the results of wearable devices in the medical field? And other one is the Internet of Medical Things. Internet of medical things. So my question is, so before come to this one, so maybe my question is, what is the Internet of Things? This is the uh, question. What is the Internet of Things? Right? Internet of Things. So, right? Internet of Things means nothing. So, if what devices connected with the internet, it is the Internet of Things, right? So, what is the internet? Basically, interconnections of many thousands or millions of elements. So, those are connected to the internet. They are doing their job specifically or commonly. So, this is a basically Internet of Things. In the internet, billions of devices connect each other, right? That is the internet thing. So internet of things, how incorporate with the health sectors? That is a big question, right? That's a big question. Before you think that, before couple of years back, now if you have any disease, you must go to the hospital physically, right? So that is the that was happened. But of course, nowadays, as I told you that internet, after the revolution of technology or internet things, right? So the medical sectors has changed dramatically, very big changes, right? So basically, the Internet of Things contribute to the health sectors very dramatically. So very big contribution to the health sectors, Internet of Things. Right? If you go, what is the Internet things? As I told you that many things interconnected in the Internet. All of them are Internet things. Internet things. Maybe your phone connected, sensors connected, people connected, professional connected, all of them are in the internet things, part of the internet or elements of the internet. So in the health sectors, right? So if we talking about health sectors, what is the uh, connection of the health sector with the internet thing? Maybe if you look at this one a little deeper, maybe people or patients or professional or expert, so we need it because this is the domain. So you just think about the medical domain with the internet, how which are the things will interconnect or involve with the medical domain. Basically, you are here, devices somewhere, your doctors in other part of the country, how you can communicate. So you need some kind of a devices. You need some kind of a network. You need some kind of a wearable devices. You need some kind of a software, right? You need some kind of a medical devices. So that maybe so in the domain, the health sector's domain. So we sure that very specific idea or very specific things will be connected. Maybe if you go, maybe just I show you this one. So just a minute. So just think about this one. So you'll get some overall idea. What is this one? So what is remote healthcare and what is maybe internet things? What is the sensors? What is the elements? You will get some big idea through this thing. Maybe the revolutions of remote healthcare. Right now, patients are here, maybe in one part of the world. The doctors are in other part of the world. Doctors are other part of the world. So you cannot visit to the doctors physically. So the technology help to interconnect the patients and with the doctors without going, without spending, without um, mm, uh, uh, getting delay. Maybe you can have now the technology give an opportunity or privilege to get the medicine. So now this is things like that. So this is one element, right? One element. Another part of a layer in between them, maybe there are some middle layer. So this is now happening. Right. So what is this one? Maybe your patients are doctors and their caregivers, maybe some other nurses and the connection of the medical people are in other part of area. Now the technology in between the people and professional or medical field, that technologies are being maybe you are using some medical servers or some specific servers. There are some kind of network technologies you're using. Um, um, Maybe the software and lot of technological things you involve with this one. In the left part of this one, maybe there are people with some devices, people with devices. So that will be as I told you, internet thing is the idea behind this one. How incorporate or adapt the health sectors, adapt the internet things, right? So the senses, now there are different type of senses, medical senses, biological medical senses available in the market. Some are ongoing research, right? So there are plenty of senses. One sense can have a multiple purposes or inbuilt or the one gadget can have multiple sensors, right? So sensing the sensing the parameters. Suppose if you wear the one sensors to check the maybe your temperature or heartbeat rate or maybe the oxygen level of the body. So just now without going to the hospital through the technology remotely, you can get the results. You can get the results. So this is a very simple, right? Especially the elder people, right? They are suffering frequently. They want to go for the hospital, visit the hospital with the help of the technology, no need to frequently visit this one. Maybe, as I told you, this one, in the middle part of the layer in between the people and the medical expert, there are some technological things you need to be considered. So there are servers there, and there are a lot of network, Bluetooth, Wi-Fi, and different type of connectivities, right? You can think that this one, right? So this will be now technology interconnect with the medical and people and the people, right? Different people and process. They have some duties. They have some tasks to involve with medical health sectors remotely, right? Now the world now think that every house, every home, smart cities concept, smart home, right? Smart people. So everywhere we are talking about smart concept. So it is applicable the health sectors also, right? So, you can wear the medical wearable device, right? Like in your home, how many people are even people, any people or number of people, they can live in a particular home. That you can make it as a smart home. Smart home. You have a smart thing inside the house, like you can make it as a smart health home, smart home. Right? So now it's possible. Now you can possible. That it is possible everywhere in the Europe countries, many places in the smart cities and in the project, even many projects is going on smart, smart traffic system, smart maybe there are plenty of projects going on. One of the project is smart city or smart healthcare system. That's smart. What's a smart healthcare system? Basically, this is idea behind this one. Involved with a technology aspect. Involved with a technology aspect. Right, you see this diagrams maybe with the help of IoT technology, Internet of technology, you can interconnect with the different elements. Maybe the patients in other part of the hospitals, maybe your relatives, and also connect with the emergency service and police service and some other services, right? You can interconnect with all these elements with a remote healthcare sector. So it's possible. It's possible. So we will able to access these kind of facilities in our countries, in the developing countries. I think probably in future, and some of the cities um, they are operating kind of these kind of facilities available. But in the western part of other part of countries, most probably they are using kind of this things, right? So uh, uh, this will be a now advanced one of technology. Now, maybe there are a lot of research papers publishing based on these ideas, smart healthcare sectors, and what technology using, and what maybe way of uh, thinking, approaching, proposing. So many now many recent papers, if you go in the very reputed journals, right? So you just think about remote healthcare just type it remote healthcare system. So, so you can able to access very good papers, recent papers. So most professional expert and researchers touching this field, they are proposing many ideas. So um, proposing many kind of ideas, techniques involved with proposing many algorithms and many um kind of approaches. So, right? So you can find many papers like this one. Right? This is say told this one. This is maybe in the health sectors, right? So it interconnect with all things. IoT interconnect with say to the patients, professional, emergency service, and maybe the police service, and caregivers, and customer, and researchers, and everywhere, right? In the IoT, interconnect with the medical field. So it contributes vast, very big contribution to the medical field of IoT, right? So uh, this is another diagram. This so this is digital data, basically who people professionals are here, and maybe technologies are here. So I will come little bit what technology behind this one. Uh, this is same as this one. Especially it is very useful people who are over the age of 50, 60. It is older people. It is a very useful. You can have many senses. You can wear many senses in different part of the body, right? You just wear the sensors and without looking anymore, you just do the involve with your routing activities, right? Routing activities. You connect with uh, maybe as I told this one, so you can wear the number of you can wear sensors, right? You can involve your routing activities. So if anything abnormal, the other part of area, maybe the who people involved with this treatment or diagnosis. So they will closely monitor you through the biotechnology. Then they will alert you. They will start the treatment. They will advise and guide, and everything will happen. So you don't need to worry about it. Just uh, yeah, something only. So it will be very helpful to the elder people who are living in the particular places, right? So that will be a very important, and this will be a remote health monitoring, right? So that is a very it basically uh, the different parameters now. They told you the disease like maybe the cardiovascular disease and uh, uh, glucose level related disease, cardio and uh, maybe this is chronic disease. Chronic disease, many under the chronic, many diseases are. So the elder people suffering with the chronic disease, many type of disease under the chronic condition, right? So it is the revolution of healthcare sectors dramatically contribute to the patients, so people in through the technological way, right? So it is a very important one. I can list out many diseases, but the timing. So I'm just cardiac disease and chronic disease, and maybe some psychological disease factors also can be treated through the remote health, yeah, sensors, right? So it's possible now. Is possible, right? So this is the idea of this one. So, so just you can wear some wearable medical things and interconnect with your phone, and it will pass to the medical professional, and through the technological say, if something happen or it goes in abnormal condition, uh, uh, then the, the they will start something, right? So it will be very easy, very easy. Now you can realize what medical contribute this. So many IoT devices are available in the market nowadays. Many IoT devices are available in the market. So we can buy and wear it with a consultations of medical doctors, right? Um, Many devices are available. These are some of the devices. And also the investment for the IoT based devices, and it is very if you look at this diagram uh, through the years, maybe suddenly it goes up, it increases. Yes. increasing. So now, day by day, there are many new things, and new finding, new the concept is coming to the world. So because of IoT, people are involved in the IoT thing, right? Especially the medical. And market trend, IoT remote patient monitoring. If you look at this one, many vendors are involved. Market trend increasing the partnership and collaboration and growing focus. And now, this now recent study says that, and also especially WHO and other health sectors funding money and and the big some companies invested money to for the improvement of the medical sectors, right? So market even not in the global, and even if you look at that in countries like India and Sri Lanka and other countries, the many uh, vendors, so many investors investing huge amount of money for this especially purposes, right? And this is kind of some insight. So we just got the idea of the companies involved this one, and global market statistics, healthcare system strengthening. So it shows that basically how healthcare sectors getting strengthened each and every year, right? This is the one of the results of this one, and also market in up to 2021. So you got this one investment. Um, Pockets. It says that so through the IoT, maybe very big idea behind the services, and maybe system software development and devices, right? And it goes up. So it is the results of uh, so now it is recent statistics says that 4 million patients globally monitor their health condition up to 2020, right? So this is the results of this one. And there are few slides more to complete my sessions today webinar. And also when I talk about health sectors or digitalization or remote healthcare sectors, there are some things that should be taken to the stage. The one thing is data. Data. It is a big data and big data. So now we are uh, going to talking about big data. Okay. So since you are a ICT professional or maybe anyone, so any background you can have. But I'm saying that the big data is a very big issue. So now, say for example, now you just wearing a one device. So every millisecond, so getting data from the patient and pass to the server, so medical server, or it's passing somewhere. So now think that within the 1 hour, half an hour, one day, 1 week, how much of data can able to collect them? So huge, it is a very big problem. So now that the now the if I want talking about medical things, so I must take up the big data concept. The big data is involved with the medical side, big data, because we are collecting so many information parameters from the patients. So every millisecond, so every second. So we are collecting a very huge amount of data. Right? That's a big problem. And that is called a big data, big data. One patient in a particular time that can have a very huge amount of data. That is one thing. So data is a very big problem. So we want to take up data. Okay, that is one thing that would be part of if you. So I just wanted to touch this one, so I'm not going to deepen things. So if I uh, want to say something about big data concept, it's construct with the four V's. One is the scale of data and analyzable stream of data, velocity, variety, different forms of data, and also veracity, right? So the four V's interconnect with this one. So just keep on mind with health sectors, remote health sectors interconnect with the big data. So if you want to predict, if you want to analyze, so if I want to touch with the data, again, I want to touch with some other computer things, related things. There are some algorithms, machine learning, and deep learning, pattern diagnosis, and something like that. So all these are connected with this medical professional and IT professional. So work together and come up with a very potential things. So this is the data. But not only the health sectors, maybe there are some other the, uh, things or some other activities or places producing much of data and maybe the YouTube. So very big data. It's a big problem how to store, how to analyze, how to uh, maybe protect from the hackers. It's a big problem, this one, privacy and everything, right? So social media and cloud. So this is a big problem to us. And also, if I want to talk again the health sectors, not only the health sectors, so we just think about the one part is the patients, other part is a medical professional. In between them, there are numerous many things involved with interconnect with the people and professional. So that will be a system. So that one thing is a big data and IoT. Another one is the artificial intelligence thing. Right? It is also incorporate with what the medical field, right? So I'm not going to deep in about this artificial intelligence thing. So if I want to talking about the medical, behind there are artificial intelligence things interconnect with the medical field, right? So artificial intelligence interconnect with machine learning, NLP, and deep learning. There are so many things interconnect with the artificial intelligence thing. So I'm going to teach you what is this one. And also there are some domain, subdomain, and subdomain things, artificial intelligence. So artificial intelligence basically a crucial part of contribution to the medical field. Right? That should be a one thing. And also one more thing I want to remember with you, the remote healthcare system. So the cloud computing, we have to store data, how to store data, how to serve the big data. So that is the concept coming in our mind. So now the place where you can store big amount of data, that is called the cloud. Cloud is a place, maybe you can store your huge amount of data, right? That is called the cloud computing. Cloud computing is a place where you can store your data, medical data. Yeah, you can store the cloud. Maybe there are different type of providers offering their cloud in a manner, and you can pay it and you can get some facilities. Not only now that concept, earlier around the concept, it was even the cloud, maybe all people are serving in a single place cloud, and you can serve it, I can serve it, other people can serve it, different type people, different type of because of the huge amount of data in a single place getting a delay to access it. After that, cloud computing, there are some new concept in the edge computing and fog computing. That is no need to directly serve in the cloud places. In the cloud, you close to the edge, right? You can serve it your data, the edge connect with the cloud. There are some concept. What I'm saying here, so we need the place to store the data, huge amount of data in a medical care. So the connection of the medical field, AI interconnected, IoT interconnected, machine learning interconnected, deep learning interconnected, and the cloud computing, edge computing, fog computing, algorithms. There are a lot of things interconnect with the remote healthcare sectors, right? Right. Okay. And of course, even mm, there are some health industries facing challenges. Even um, if you think that to improve the uh, health sectors or remote healthcare sectors or patient monitoring sectors or digitalization of the health sectors. So there are some disappointed too. There are some problem. We need to get a solution. So that one big problem is information privacy protection, and that's a big issue. Security issues, right? So that is a big issue. Rather, other concerning factors. So these are the very crucial issues now. How you can make sure, how you can promise to your client, so we can serve your very personal medical record, right? How can keep without accessing other people. So that's a big issue. That is a big challenge. Big challenges. Even if you promise it, we cannot 100% with technologically we can make sure that that is people. That's a one notice that how people uh, uh, getting delay to interconnect with this kind of medical system. So because they are seriously thinking about their personal health information. That is a big problem or big barrier to interconnect this one. So that is a so my part of this webinar, so I can summarize what I discuss, what I sees the Um, what I shared with you, this is basically from the digitalization format. It happened recently, couple of years back, maybe the health sectors, like other sectors, health sectors also became a digitalization format, coming to digitalization format. Not in the, it is developing countries we are now working on, not uh, not now we are processing. So in developing countries, some cities adopt this kind of a system, and but each and every countries they are concerning about their people, health sectors. They are investing much amount of money to make the waterproof system, so that now it is the ongoing process. So it is okay. Then for this one, many uh, people work behind this one. So the medical, IT, and other stakeholders working on that one. So what's the purpose of this one? If you develop the kind of the system, it will be a very digital system. So maybe it is a solution. I'm not saying about this is a fully solution to the all kind of a disease what we have it. No. So it is a kind of a solution, right? It is a part of the solution to the for the uh, particular disease. It is not a potential solution to the whole kind of, right. Anyway, it is a kind of a solution to the particular diseases, right? Even the very first step, so right, without you can get some idea, right? So to for the next steps that will be there. And also maybe many technological aspect involved this one. As I told you, this one, IoT is a big concept, and there are softwares, many softwares, algorithm, wearable devices, maybe even the sensors, development of the sensors, and the network part, another devices, maybe uh, to interconnect to, and there are artificial intelligence, and also you need some places to store the medical data. Maybe the comes in mind the cloud, the cloud computing, edge computing, fog computing, and there are and also interconnect with some servers, medical servers, also maybe some devices like some computers, or maybe the mobile computers, and you want to develop some apps, mobile apps for your doctors, maybe the caregivers, or maybe the family members. And also you can make it some alert system, maybe with a connection of the caregivers or family members. And also you need some legal way, maybe you can connect with the system remote health, yeah, with the police station, and also some emergency unit, maybe ambulance system, so you can interconnect through the technology. If one thing is happen, it parallelly it work with all these entities, all these entities. So that will be a result of this one. So maybe I'm just summarize what I discuss today's international webinar session. So I hope that you get some ideas and points from my today's session. Finally, I will thank you all to participate this webinar session. And also, I must thank to the people who are working under the research circle, that they um, created a platform like this one to share some idea with this other part of this people. So thank you, research circle team members, directors, and other people. Thank you, everyone who has participated directly and indirectly with this session. Thank you very much. Hello.
Yeah, yes, sir.
I have finished my session.
Yeah. Okay, sir. Thank you so much for this very nice session. If anyone has any question, you can ask. I think no one have any questions, sir. Thank you so much for the participants for your active participation. Let me inform to all that this complete session will be available on our Research Circle YouTube channel. So if you want to watch it again or want to share it to somebody, please do visit the Research Circle YouTube channel. Thanks. And last but not the least, thank you, Mr. Mansoor, for taking out time for a session. With your permission, I would like to end today's session here. Thank you, sir.
Thank you very much. You can conclude this and we can end the session.
Thank you, sir.